This is In the Loop. I'm Christian Bryant. Legal battles over abortion have sprung up across the country since the Supreme Court overturned Roe v. Wade. There's been confusion among medical providers, patients, and law enforcement over what information could be used against someone in court if they try to get an abortion that's been criminalized. In particular, there's been a lot of discussion about what medical info law enforcement can get by just using what's already on here. And it's actually much easier to get than you might think. But before we get there, you may be thinking, medical data is mostly private anyway. How much damage can be done? Well, let's talk about HIPAA. A lot of Americans might assume any medical decision, procedures, or data is completely protected by HIPAA, the Health Insurance Portability and Accountability Act. The law created standards to protect sensitive health info from being disclosed without patient consent. But there are a lot of misconceptions around what HIPAA actually covers and what it doesn't. This can potentially include anything that might indicate a patient was considering and seeking an illegal abortion, not just the procedure itself. For example, crisis pregnancy centers, or CPCs, may look like clinics and do generally target women considering abortions, but most are not licensed and have no licensed medical professionals on site and have historically aimed to dissuade patients from ending a pregnancy. CPCs aren't legally held to the privacy rules of HIPAA, so any visitor info can be disclosed at the CPC's discretion. Anyone who comes in expressing a desire to get an abortion may be incriminating themselves if they're located in a state where abortion would be now illegal. And for services that are subject to HIPAA rules, like a typical hospital, the data protections are still not as strong as you might think. To start, there are 12 national priority purposes within HIPAA that allow for info to be disclosed without your permission. Law enforcement is only one of them. Info can be disclosed for things like court orders, identifying potential witnesses to a crime, or if the entity holding the info believes the medical data is evidence of a crime. It should be noted, the Department of Health and Human Services issued updated guidelines to clarify privacy rules specifically relating to abortion. For example, they noted any hospital employee who suspects a patient had an illegal abortion cannot report to law enforcement unless the state's law requires it. It's important to understand this doesn't fundamentally change HIPAA, nor plug these security gaps in HIPAA completely. Some legal experts have noted healthcare providers are one of the most common ways for a patient to be prosecuted, but it's not the only one. Many cases also begin with a personal report to law enforcement from an angry partner or acquaintance. And once law enforcement is alerted and the prosecution is trying to determine if a pregnant person tried to end their pregnancy, that's where that phone data is going to come into play, and there is a lot of data they can pick through. Apps that collect and store important health information can have surprisingly poor privacy protections. Digital health products aren't covered by HIPAA, so companies have more flexibility with your data. And an investigation from the tech outlet Motherboard found just how easy it was for data brokers to buy and sell data from apps like Clue, one of the most popular period tracking apps in the US. And keep in mind, that's all without a warrant. The team bought a sample of data for just $100 off the data marketplace Narrative, which is a platform that lets anyone easily sign up and purchase app info directly. The purchase took just minutes and included over 5,000 identifiers for devices that allegedly belong to Clue users. These kinds of identifiers are technically not supposed to be connected to names and people for anonymity, but it should be noted there are legal ways to connect those dots anyway. Clue released a statement claiming the identifiers don't correspond to user IDs and that they don't know where this data comes from. Also, it's not just health-related apps that might be incriminating. Any ordinary apps can have location tracking data, and Motherboard also found at least one data broker who has sold location info for users that visited abortion clinics. We've already seen at least a couple of cases where women have been incriminated using data like this. Not even medical info, just data as straightforward as your search history. Take this case in 2017, where a woman in Mississippi was charged with murder after a failed pregnancy. She had confessed to a nurse she had wanted to terminate the pregnancy, so prosecutors tried to prove this with search history on her phone that showed she looked into options. The murder charge was eventually dismissed. In 2019, prosecutors also used the browsing history for a young mother in Ohio to try and argue her stillborn baby was actually killed. She was also ultimately acquitted of murder charges. And that was all before the overturning of Roe v. Wade. It's likely we may see many more cases like these. With so many limits to HIPAA and so many ways companies or government entities can access health data, it's easy to feel like all this info is just impossible to keep private. But that's not necessarily the case. On both an individual and a policy level, here to tell us more is Andrea Downing. She's the president and co-founder of the Light Collective, an advocacy group of patients, clinicians, and medical data experts. Andrea, thank you so much for joining us.
Thank you for having me. It's great to be here.
Wonderful. So when it comes to our phones or our internet search history, what are some ways we can keep our data even more secure?
Great question. There's actually, unfortunately, very little here in the US that we can do as patients or users to make our data more secure. The basic things you can do are, have strong passwords, make sure that you're using a browser that isn't kind of predatory. I usually recommend Brave or Firefox. I also suggest that you get something like a VPN, which is a way of making sure that your IP address is masked or protected when you're visiting websites. That being said, I think it would be disingenuous of me to give you the impression that everything that you do on the internet is going to be protected. We don't want to make people going through the trauma of a diagnosis think that they have to take all these actions alone, but rather we need to collectively think about our privacy.
I see companies behind apps or running social media advertise how they keep our data secure or don't sell it to anyone, etc. Who is enforcing that or supposed to be making sure our data isn't sold or given away?
It's a great question. HIPAA is a law that is kind of governed under the Department of Health and Human Services and Office of Civil Rights, but it only pertains to what we think of as a HIPAA covered entity or fits the legal definition. So if you are receiving medical care that is reimbursed by your insurance, that typically is where something is protected under HIPAA. But when you're using your phone, when you're posting on social media, when you're downloading a health app, those things are actually under the jurisdiction of the FTC, the Federal Trade Commission. And as of today, there is one health privacy law on a federal level that is already on the books with the Federal Trade Commission, and that's the health breach notification rule. However, that one rule that has been in place since 2009 under the Obama administration has never once been enforced. So it kind of begs the question, do we really need new legislation? Or do we also need to think in terms of the enforcement of existing laws that are out there that haven't been enforced?
Andrea Downing is the president and co-founder of the Light Collective, an advocacy group of patients, clinicians, and medical data experts. Andrea, thank you so much for your time.
Thank you. Very glad to be here.